In this video we will cover all the high-yield points of hypersensitive pneumonitis. Hypersensitive pneumonitis is a combined type 3 and 4 hypersensitivity reaction in genetically predisposed individuals. We will use farmer's lung mnemonic to cover all the important points of hypersensitive pneumonitis. F is for flu-like symptoms, which are fever, chills, cough, malaise and headache. This disease has very general signs and symptoms. A as in acute type. Flu-like symptoms are present in acute form of this disease. Theirs is a chronic form of this disease as well, in which cough and dyspnea can lead to cyanosis. R shows respiratory symptom, which is dyspnea without wheeze. On a side note, wheezing is a characteristic of obstructive diseases, not the restrictive diseases. M is for mask. Farmers are advised to use dust masks to avoid exposure to the antigen, which takes us to our next point, that is exposure. E is exposure to the source of antigen. Source of antigen for farmer is moldy hay, straw or grain. In case of bird fanciers, lung source is avian excreta, feathers or proteins. R signifies the recurrent episodes of symptoms whenever the person is near the inciting antigen. S is for scan. High-resolution CT scan is the most significant investigation in this case. Findings on the scan are honeycomb appearance of lungs, ground glass opacities, thickening of alveolar septa, traction bronchiectasis and inspiratory mosaic attenuation. L is for late inspiratory crackles, which we find on auscultation. U shows upper parts of lung. Upper part of lung is affected predominantly in this disease. N is for non-fibrotic variant of this disease. We are discussing fibrotic type of hypersensitive pneumonitis, but there's non-fibrotic type as well, which is inflammatory in nature. G is for glucocorticoids. Other than general measures of avoidance of antigen and use of dust mask, glucocorticoids are given as immunosuppressive drugs to control this disease. If patient has contraindications to steroids, other immunosuppressants like rituximab or azathioprine can be given as well. That's all for today. Thanks for watching.